Presiding Officer, I wish to update the Parliament on the extraordinary pressures facing our National Health Service this winter and the measures that the Scottish Government is taking to address them. Let me begin by stating a simple fact, that this is the single most challenging winter that the NHS in Scotland has ever faced. Our NHS, its committed workforce, is facing a perfect storm of intense pressures which are leading to extreme difficulty, disruption and delays right across the service. This especially challenging time for the NHS will continue, we suspect, for the coming weeks, and as I've said previously, the full recovery of our NHS is not something that will take weeks nor months, but it will take years. Presiding Officer, let me once again take this opportunity to thank our incredible NHS and social care staff for continuing to provide exceptional care under what is the most difficult of circumstances. Our entire health and social care system is facing the continuing impacts of the pandemic, the biggest challenge our NHS has faced in its 74-year existence. COVID remains a pressure on our health system, with most recent statistics showing COVID cases are now at their highest levels since the summer. In the week ending the 1st of January, there were over 1,200 patients in hospital with COVID-19, a 15% increase from the week ending on Christmas Day, and double the number of patients from 4 weeks ago when there were over 600 COVID patients. Recent flu admissions were also around 3 times higher than emergency admissions due to COVID, and there have been rising cases of strep A and other respiratory viruses. Challenges around delayed discharge of patients also continues to have an impact in driving up A&E waiting times, and overall pressures on the health system are significant. Last week, latest management information showed that hospital bed occupancy across Scotland was over 95%. Some sense of the intense pressure being felt can also be seen in the almost 100,000 calls to NHS 24 over the 2 4-day breaks of the festive period, the highest festive period demand for over a decade. Traffic to the NHS Inform website and the symptom checkers in December was at its highest level ever, with 12.7 million page views. The impact on the ambulance service has also been significant. It dealt with over 16,000 emergency incidents last week, 11% more than the average of the previous 4 weeks. Whilst this highlights the significant levels of demand we face, it also profiles the innovative ways we're seeking to tackle this issue, providing effective triage and supporting hospitals and social care settings. But the challenge is significant. These seasonal pressures come against the backdrop of the UK Government's mishandling of both Brexit and the nation's finances, with such dire consequences for Scotland's social care sector in particular. Whilst fully acknowledging the multiple difficulties we are facing, this Government is determined to continue taking action to alleviate some of the pressure in our NHS and social care. I'm convinced that we should pursue a whole systems approach to tackling these issues and to support from all parts of the Government, the NHS and social care through the critical coming months. On last Friday, the First Minister chaired a meeting of the Scottish Government's Resilience Room SCORE to determine the next steps in addressing the unprecedented pressures across the NHS. As well as ministers, the meeting was attended by senior representatives from COSLA, the NHS, Integrated Joint Boards and the Scottish Ambulance Service. It reviewed the number of measures being taken to alleviate pressures on the system. These include the use of flow navigation centres as part of the redesign of urgent care, the hospital at home service and ambulance service staff providing treatment where appropriate to help avoid hospital admission. Additional actions will now be rolled out across the health and social care system, and I can today outline a further course of action to unlock additional capacity to alleviate the pressure of delayed discharge on the system. Presiding Officer, as I have mentioned, delayed discharges and their impacts on patients continue to be a significant issue. It has not only been exacerbated by increases in staff absences due to self-isolation requirements and sickness, but the number of care home places has been impacted by care home closures too. There is no doubting that high inflation and high energy costs have significantly impacted a sector that was already facing multiple challenges. I know that teams across the country are working exceptionally hard to ensure people are receiving the right care in the right setting. However, the fact is that at present there are more than 1,700 people currently in hospital who do not need to be there for clinical reasons and whose interests are not best served by being there, because care packages that would allow them to be discharged home or to a care home are simply not in place. Presiding Officer, to this end, and as an additional and exceptional measure, COSLA and the Scottish Government have worked with partners across the care home sector to identify additional interim spaces within care homes to help provide additional pathways for people to be discharged from hospital in a timely and safe fashion. To support health and social care partnerships secure the extra provision, we're making funding of £8 million available so beds can be purchased at an additional 25% above the National Care Home contract rate. We will work closely with partners across the NHS, health and social care partnerships and local authorities to ensure appropriate use of funds and evidence of the impact this funding has. This is an in extremis, time-limited measure that is required to help us with the current capacity issues that we face. The additional funding is intended to meet the increased costs of utilising these beds for a short period of time. With partners working collaboratively, we've managed to identify around 300 interim beds that are available. This is in addition to the 600 interim beds that are already helping patients in the system. This support is intended to be used as an additional tool that health and social care partnerships can deploy to support during the current situation and allowing additional flexibility to maximise capacity within our hospitals. We will work with partners to utilise every bed possible. These interim beds may not be a family's first or indeed second choice for their relative, but I hope families agree that in the current circumstances, this is about making the best possible choice for those in our care. This measure will only be in place for a limited period of time to directly support our hospitals to deal with pressures at the front door. However, it will enable some people to move from an acute setting to a more appropriate community one, recognising the risk of prolonged stays in hospital. In addition, to respond to winter pressures, a ministerial advisory group has been established now for a number of months. This group meets weekly. It brings together Cabinet ministers, such as the Deputy First Minister, myself, Shona Robertson, other ministers, COSLA, key stakeholders such as Scottish Care, to advise on pressures within the system and look at possible actions to mitigate them. This week, further guidance has been issued to boards, making it absolutely clear that they can and should take steps to protect critical and life-saving care if that is judged to be necessary. Boards can, of course, ask government for advice as and when that is required. We believe that local health boards are best placed to judge what reasonable measures should be taken in each local health board area. These measures could include, among others, opening or procuring additional capacity, moving staff to areas of pressure, increased engagement with the third sector, or potentially delivering a different model of care for a short period of time. In my role as Health Secretary, I do, of course, retain the emergency powers and ability to direct that are set out in the NHS Scotland Act 1978. I'm well aware that more severe measures, such as blanket pause of elective procedures or key diagnostic tests, are not without impact on the health service and indeed on patients. So I believe it is important at this time that we ensure that NHS boards have the ability to respond flexibly to local circumstances and to deploy local solutions. Advice has also recently been issued to local leaders that provides clear guidance on the expectations around assessment and discharge practice and around care home oversight arrangements. We're also seeing record numbers of patients delayed under the adults with incapacity legislation. These are patients who, although clinically ready for discharge, cannot be legally discharged without a court-appointed guardian being in place. Officials have been working with the Scottish Courts and Tribunal Service and the Law Society of Scotland to investigate where improvements can be made to ensure that people are able to be discharged in a timely manner. I've also met with both the Mental Welfare Commission and the ECHR this winter in regards to matters that are affecting adults with incapacity. While some of the measures I have just announced are to help in the short term with the immediate pressures we're facing, we are, of course, also putting in place the long-term steps that are necessary and needed to address social care challenges that we face. We have invested significant additional funding to support social care. And this includes, for the current financial year, £124 million to enhance care at home capacity, £200 million to increase the hourly rate of pay to £10.50, £20 million to support interim care arrangements, and £40 million to enhance the multidisciplinary teams. A further £3.6 million of funding has been made available in the 22-23 budget to support the further development of hospital at home across Scotland. Presiding Officer, it's clear that our accident and emergency services in Scotland are being impacted severely by the winter pressures. The situation is, of course, not unique to Scotland. Indeed, Scotland's A&E services continue to outperform those in other parts of the UK, and they have done for the last 7 years. But that is, of course, cold comfort for those who are waiting far too long for treatment. Scotland already has record numbers of NHS staff, and we're recruiting more staff as part of our winter plan. However, it's very clear that far too many people are waiting far too long for care, whether that's for an ambulance response or waiting too long for treatment when they attend our A&E departments. So we've taken action to improve A&E waits, including plans to recruit 1,000 new NHS staff and roll out of the £50 million urgent and unscheduled care collaborative to help drive down these waits. These measures include initiatives such as hospital at home, ensuring people are directed to the most appropriate urgent care settings, and scheduling urgent appointments to avoid long waits in A&E. We've also increased the amount of virtual capacity hospital-level care provided at home to the size of a large teaching hospital. Presiding Officer, we will also bolster workforce capacity within NHS 24. NHS 24 is an incredibly effective service, and through the expert advice offered, the overwhelming majority of those who call NHS 24 do not need onward transfer to already busy A&E departments. This winter, NHS 24 is taking forward planned recruitment of around 200 new starts before the end of March. As part of this recruitment, the Board has appointed over 40 whole-time equivalents, call operators, call handlers and clinical supervisors in the run-up to Christmas. While call wait times for NHS 24 were often longer than usual over the festive period, the vast majority of calls received were dealt with through their initial contact. Despite the pressure I have outlined, we are seeing progress in some key areas across the system. For example, excluding NHS Lothian, the latest figures show that despite continuing pressures, almost 19,500 operations were performed in November 2022. This was almost 21% higher than November 2021, when over 16,000 operations took place. This also marks the highest proportion of planned operations performed since the start of the pandemic, with over 91% of planned operations performed. So that is progress in relation to our elective care. We are offering more support outside of hospital settings to assist people seeking help with common winter illnesses. NHS Inform has self-help guides to help to let everybody know when to stay at home and when to seek more care. GPs and pharmacies can also be contacted as a first port of call for non-critical, non-emergency care. And I would like to add a reminder for all of us that if you have symptoms of a respiratory infection, try to stay home and avoid contact with other people. If you do need to leave home, we strongly recommend that you wear a face covering. Presiding Officer, I understand that the NHS is built on the people that work in it, who have had to work through incredibly challenging circumstances for years. The pressure of the pandemic, almost 3 years of a pandemic, has been relentless. I will always be available to talk to our committed workforce who provide incredible care for the people of Scotland day in and day out. I'm grateful to Unison Unite and other trade union members who have accepted this government's record pay offer for NHS staff. In fact, the majority of trade unions on STAC, the Agenda for Change Pay Negotiating Committee, have accepted our pay deal. And while I'm naturally disappointed that we haven't got agreement from every trade union. I'm also grateful for the positive engagement with the GMB, the Royal College of Midwives and the Royal College of Nurses that has taken place. I'll continue to pursue meaningful dialogue with all trade unions to try to invert industrial action. We sincerely hope the additional pressure of industrial action can be avoided at this very, very challenging time for the health service. For my part, I remain absolutely committed to dialogue and positively engaging with our trade unions. Presiding Officer, as I have outlined, unprecedented challenges continue to have a real impact on the NHS and on people right across this country. Whilst we face an extremely difficult period ahead, I remain confident that with the combined effort of our incredible workforce and the determined will, certainly of this government, these challenges will be met. Not only will they be met, but they will be overcome. Presiding Officer, let me end where I started, by thanking our outstanding health and social care staff for their Herculean efforts during these extremely challenging times. We will continue to honour them, not just with warm words, but through our deeds too. Thank you for the ability and the time to make this statement. Of course, I'm happy to take questions from across the Chamber.